Hello, and thank you for tuning in to the recording of the Let's Talk Public Health Prepare to Pivot webinar from December 10th, 2025. This webinar was looking at the potential outlook for public health communication in 2026 and beyond. The learning objectives for this webinar were one of three. First, to examine the current and future state of public health and health communication. The second was to analyze the changing media and technology landscape and identify strategies for navigating upcoming shifts. And then to introduce and apply the Let's Talk Public Health Pivot framework as a guide for adapting communication systems. So let's get into it. The biggest thing, federal funding and cuts, the proposed reduction in staff, a lot of that has happened specifically within the Department of Health and Human Services. But if the proposed cuts to the Prevention of Public Health Fund happen, that's going to severely diminish funds at the state and local levels that we use to administer a lot of programs and grants. In the Big Beautiful Bill, this is where a lot of this is pulled from, and some of it is executive orders that have passed. But there's a lot of federal restructuring happening. So you have at the administrative level, you have the creation of the Make America Healthy Again Commission, the Administration for Healthy America, and this shift in focus toward chronic childhood diseases and addressing poor diet, environmental toxins, physical activity, chronic stress, and over medicalization. Those are kind of the key hitting points when you read the MAHA report. There's also an effort to centralize communication across the agencies. And so we have the creation of the Assistant Secretary for Public Affairs and the creation of the Office of Assistant Secretary for Public Affairs, also known as ASPA. So if you do any work with federal agencies, any communication related work, now you send anything that needs to be approved to ASPA and they approve it and then put it out on the channels. Before you had like an office of communication within every agency and it was very fragmented. And now it's being centralized, which can be helpful in creating more unified messaging and just streamlining things. So that is a potential positive, but anytime you centralize things, it also increases the capacity for censorship. Like I said, there's a lot of restructuring, there's a lot of refocusing within HHS. Two of the hugest mission refocuses are going to be CDC and NIH. There's proposed reorientation of CDC's focus to infectious disease, epidemics, and outbreak preparedness. A lot of the chronic disease programs are being proposed to be eliminated. NIH, you're having the consolidation of many of the institutes into, I want to say it's like six or eight. And then again, a shift in focus towards nutrition, environmental factors, mental health. And again, that's just going to take a huge hit. These two agencies within the Department of Health and Human Services have the highest brand recognition among the public. So when you say like a public health agency, they're less likely to say HHS and more likely to say CDC or NIH. They actually recognize those departments. So we're going to have to kind of wait and see how these shifts affect things. But you do know that if they do pass, and if you're doing any work in the community that's around specifically chronic disease programs, that you're probably going to have to do some significant pivoting to find different funding sources and to try to align your messaging so that you can get funding. When you look at the communication cuts that have happened that are cutting our ability to be able to communicate and coordinate, our withdrawal from the World Health Organization, that's going to completely cut us off from international public health surveillance data. It's limiting our access to that international data and our ability to coordinate in a global health crisis, which is scary to say the least. With the rescission of prior public health orders, is another executive order that made a lot of changes. One specifically directly connected to health communication is the Public Health Data Modernization Initiative and the Federal Task Force on Health Misinformation, which are both being revoked. And then the elimination of federal funding for public broadcasting, even though this isn't directly like an HHS related department or agency, NPR and PBS are two huge channels for health related messages. This is actually like a huge hit. This was one of the ones that I was like, oh my gosh, this is gonna, I don't know where we begin to recover because we partner with NPR and PBS for a lot of donated airtime for public health campaigns on the national level. So with the cuts in funding to those two platforms and the fact that those sometimes it's NPR and PBS are the only stations in like remote or rural communities, it's really going to cut us off from some communities and being able to reach them, taking away a huge channel that actually has a good amount of trust with the public. So we are definitely going to have to think about how we can pivot, move to different channels to try to still reach our communities and our audiences. I have like a whole tracker of these and other changes being proposed across multiple agencies. So even changes happening in like the Department of Commerce, that's where the National Weather Service is and NOAA is. Um, Changes to the Department of the Interior, where the National Park Service is. There are a lot of changes like consolidating and restructuring different agencies and also just like cuts to programming that really will have an impact on the health outcomes across the nation. So if you want to go on our site, there's QR code here. Take a look. There's a good list, and I'll be trying to update this about once a month, more frequently if I'm able to. When you're looking at media and technology, there are a couple of shifts that have been in the making that are only continuing to get worse, that also really influence how we'll be able to reach our audiences and our communities. The first is just the consolidation of media ownership. So we have a handful of companies and private equity firms that are buying up a lot of our local and regional media, and that just puts our potential channels for reaching the public in the hands of a few individuals at the end of the day. And depending on what those individuals want to do with those platforms, it can impede us from being able to reach our audiences. And so we have to really keep an eye on who owns what changes may be implemented. A lot of these platforms are algorithm driven, and that's another one on here is our like reliance on algorithm controlled platforms. Algorithms, they show you more of what you like or what they think you will like, which creates echo chambers, reinforces existing beliefs of people, narrows your exposure to opposing or diverse viewpoints, and then just intensifies polarization, which is what we're dealing with now. And then depending on, the censorship of these algorithms and what types of content they're flagging and suppressing, it can make it really difficult for reaching audiences. And it's always kind of been getting harder and harder to reach people organically anyway. And the model, the algorithms really kind of push you to have to pay to play and do paid ads to really make sure you're reaching who you want to reach. But it's just getting even harder to reach people organically. And then if content about public health related issues is being suppressed, it's another layer of a barrier for us to get out on these platforms and get our messages out. We have the loss of local media. A lot of very community specific news is just being dropped completely. I'm even seeing that here in DC, and I've seen just the death of multiple local papers and like their online websites, which then makes getting news about what's happening specifically in my community, what's happening in policy in my community really hard to get. And it makes me have to actually go online and like search for that information, which again just makes it even harder for us to reach people with the news that they need to know. And then you have AI and AI generated misinformation and disinformation. So there was a series of deepfake videos going out on TikTok and Instagram. So like these are short form, like reels, where they took the real videos of actual like health related influencers, medical influencers, and created alternative versions where they tweaked the words to promote like a specific brand of supplements. And so now we have to think about how we're combating this very intentional disinformation where you have people out here paying to share potentially harmful or just like inaccurate health information or to push people to buy health products that may or may not be beneficial to them. And all of that just makes people even more suspicious and not know who to trust. And this is the data that shows us that the trust it's going down. You have this Kaiser Family Foundation poll on trust in different health related institutions and political figures. And you can just see that healthcare professionals are still the most trusted on the list compared to public health officials, scientists, and then our health secretary and our president. Kaiser Family Foundation also split up the information based on political party. And then you can see huge differences between where people who identify as being a Democrat or an independent or a Republican, the shifts and changes where trust in Political figures went up, and people who identified as Republicans, independents, they were in the middle. And then folks who identified as Democrats had the least amount of trust in political figures. And then it went the opposite way once you move up the chart to public health related agencies and scientists. A similar chart, this one's about trust. This one's from Gallup, but it's on Pew Research Center, but just showing how mass media has taken a hit and how the number of people who don't trust media is increasing, and then the one who do trust media a great deal or a fair amount is decreasing. So we know we have huge problems in trust in public health and then trust in mass media, which was a huge way that we got a lot of messages out and still continue to. And then when you compile that with the decreased funding in the free public media part of the mass media sphere, it shows a dire situation firming up for the media landscape in which we have to get our messages out. This is what I think through as I'm planning or working with my clients. I think through how we can build in systems to anticipate. In public health, we tend to start at the listen. We do a decent job of monitoring and doing as much surveillance as we're able to with the limited budgets we already had before these cuts happened and the limited infrastructure that we have related to surveillance and sharing health related data across states, across agencies. But we're doing what we can. But to really be able to put yourself in a position to be able to pivot, you really have to actively anticipate. It's not enough to keep your ear to the ground and use your normal data inputs, whether that's for health communication, monitoring social media. You can track your sentiment or your mentions, who's talking about you. You can search topics and see what the conversation is online. And that sort of listening, that's one layer. But we really need to be actively forecasting. And there's different ways that you can do this. Just monitoring what's happening in the commercial space, in the political space, trying to forecast what's going to happen in your local elections and where policy might shift and coming up with plans ahead of time. Just keeping a list somewhere, a document somewhere within your organization that everybody has access to, where you've got a list of things that are, percolating, and you're keeping an eye up on it on a regular basis and updating and having a way to prioritize which things you actually need to bring to discussions and start planning around and which things you need to keep an eye on. But really setting up that infrastructure so that you're not being caught off guard and that you're not just reacting to changes. So even though there's a lot of controversy, one of the first things I would do is go into Project 2025 and start searching based on my community and like geographic location, the communities I serve. Think age, think sex, think gender identity, think specific health issues, and really do some keyword searches and see what potential changes are on the horizon. And just make sure you're monitoring to see if those things are actually happening on the national level, but also locally in your state and or Lake County. You just can't ignore these things, and it just can't be passive. You can't wait until the Instagram posts come out and the tweets start to build up. Being active in building that type of forecasting into your processes and having that be in your SOPs and coming up with some sort of system for it to be a regular part of your meetings is going to be really key to making sure that you're able to then know when it's time to start discussing something. If there are like 3 or 4 things that need to happen for something to be a concern, then once it gets to thing number 3, we might want to be talking about it within our organization and making sure that we are thinking through what our potential next steps might be. Having some kind of formalized system for that is just really going to help you so that you're, again, not being caught off guard. Because a lot of the times we respond to a crisis instead of anticipating it and then having processes in place to be able to plan for it accordingly. The key thing here is that anticipation phase is going to really determine whether or not you're set up to pivot. Because if you're keeping an eye on things and you are actively, regularly looking up to see changes that have happened, and then knowing and having a system for bringing emerging risk threats, trends into your meetings and with decision makers, and really have a process for making plans. Then if things do shift a certain way, you're already ready to go. Once everybody's talking about it, it's typically a little too late. And that's why the listening phase isn't where we need to be starting. It's an important part of the process, but we really need to be actively looking and seeking out this information to make sure that we're prepared. Make sure that we are listening and monitoring what's going on, what are the issues that are happening in terms of determinants that might affect health, and then actual health issues and outcomes that we are starting to see. And then just monitoring misinformation and different disinformation that's happening. Kaiser Family Foundation, they actually have like a misinformation, disinformation tracker. But that's a really good one to monitor, and it's looking nationally. But you also want to make sure you're listening and looking out for misinformation and disinformation on the local level. And then the translation stage is all about converting the feedback that you're getting, the data that you're getting into meaning and really into action. So where does this take us next? What does this really mean for us? And then how do we translate what this means for us in a way that is going to actually resonate with the people it needs to resonate? Because in public health, it's not just about reaching our communities and our audiences, if you're more like in the health influencer space, but it's also about making sure we can convince the partners that we need to be on board to be on board. And it's those like cross-sector collaboration and coordination that's also important. So understanding how to translate things into meaning, something that's meaningful and useful for whoever you're talking to is important. And then engaging those partners throughout the creation of whatever health communication materials are going to come out through that process. And then after that, just monitoring the effectiveness of those materials. Did they resonate the way that we thought? If you're sharing them online, are we actually reaching the people we want to reach? What are those metrics telling us? Do we need to put some paid dollars behind this? What does that look like? And then adapting accordingly. So, when you're seeing either things shift in real time or you're seeing from your monitoring that you're not quite hitting where you want to hit, being able to adapt your plans or your messaging or creative or whatever it is to make changes to see if that makes a difference. So that's it. Again, nothing super groundbreaking, just how I think about it and go through it as I'm building processes for my business or as I'm working with like local state health departments, helping them build infrastructure. These are the steps that I'm building into their documentation and processes and their SOPs to make sure that this is something that just becomes a part of the culture of the organization and is just a part of how they do things. I have just put a couple of potential strategies down, just really concrete things that become part of your SOP, whether it's weekly scanning, just having someone on the team who takes that spreadsheet of concerns and policy things and commercial things. Maybe there's a specific business that might be moving into your geographic area. And if they do, they're going to bring a lot of environmental pollution or something, and you're like tracking and monitoring that situation. Someone who takes that document with all the potential things in it, and every 2 weeks or once a month or whatever that looks like for your organization and what they have the capacity to do, they're just updating it and they're checking off. Do we need to escalate this? Do we need to start planning? Did this go away and nothing actually happened? That sort of thing. Establishing quarterly scenario planning updates. So having set meetings where you talk about the progress of things and talk through what you're seeing happening, whether you're developing rapid response pre-bunking messaging. So to be sharing things before those disinformation and misinformation messages even get out in the first place. Building an ambassador program for community trusted messengers and channels. This is going to be really important to help with breaking through algorithms, making sure that you build in potential other channels outside of the algorithms that are trusted. It's not just about partnering with digital influencers who reach your audience. It's also about where are the places in the community that people go? And can you build relationships with those businesses in those spaces, organizations in those spaces, so that they are a potential place for messages to be posted or have potential messengers there that are trusted that can share those messages and information. And then just tailoring your outreach and any like messaging you do with co-design. So including whoever you're trying to talk to from the jump, that's just like best practices. I'm going to open it up for Q&A. Again, we're a small bunch, so feel free to bring questions, reflections, thoughts, and we can chat for the next 30 minutes, or if you guys feel like you're good to go, we can go. But thought I'd just kind of open it up to see what you all were thinking and if you had any insights.